It's great to be here at EA Global, and as was mentioned, today I really want to talk about, there's been tremendous progress that the EA community has made in terms of identifying highly cost-effective top charities that demonstrably improve the lives of some of the most marginalized communities in the world. But how can we use those same tools around rigorous empirical evidence in order to answer the next set of questions and ethical trade-offs facing the EA community? So I'll skip over this because it was already gone over that ID Insight works with governments, multilaterals, foundations, and quite notably with effective altruist partners such as GiveWell and NGOs like Against Malaria Foundation and New Incentives to really identify what are the most cost-effective ways that we can improve the welfare of people around the world. And today I want to argue that in order to do the most good possible, EAs should, one, continue their emphasis on using rigorous impact evidence in their decision-making, but two, and quite critically, expand the scope of what they consider as potentially impactful, cost-effective interventions in charities beyond direct service delivery organizations and really think about how do we leverage the tremendous resources that developing country governments are already spending trying to improve the welfare of their citizens and really use levers such as research and advocacy to unlock a lot more impact beyond just giving to direct service delivery organizations. And then finally, and perhaps most substantively, I want to argue that EAs need to think a lot more about what are the subjective values, preferences, and moral weights of the populations that are actually affected by the programs that are happening in global development, communities in rural East Africa, communities in South Asia, and factor those into their resource allocation decisions and move beyond just our own strict utilitarian definitions of what's the best thing to do with a certain set of resources. So these are the three arguments that I want to make today. And to start at the most basic and fundamental level, I think a pretty uncontroversial claim here is that we need to continue to think about rigorous impact evidence in determining how we spend our resources. So there's a simple example of money spent incorrectly. So there were a Millennium Villages project led by Professor Jeffrey Sachs from Columbia University, which basically tried to lift individuals in sub-Saharan Africa out of a poverty trap by providing a whole host of goods and services from education, agriculture, and health. And they went around showing a graph like this that, look, over a 4-year period, we're able to increase household asset ownership 4-fold. And based on this, we should invest a lot more money in this program. And so based on evidence such as this, millions of dollars were raised. But if you take a closer look at the evidence, you see that the same dynamic was there in the rest of the Millennium Villages region, the same in all of rural Kenya, and the same as all of Kenya as a whole. And so clearly there was something happening in sub-Saharan Africa over this 3-year period that was enabling people's lives to get better that had nothing to do with the Millennium Villages project. And so I think this is a cautionary tale that we need to think about evidence in a rigorous way in order to make the right decisions, and that if you just look at kind of the easiest, most available data, you can often make incredibly incorrect decisions that end up wasting millions of dollars that otherwise could have gone to improving lives. And so I think that's a kind of foundational assumption within the EA community, but I think important for the rest of the discussion. The second claim I want to make is that as important as it is to focus on demonstrably improving the lives of the poor, we also need to be a little bit riskier in what we think about as potential top charities. In particular, I want to kind of challenge the EA community to think about things like advocacy and research as ways to improve government spending, as a potential complement to investing in direct service NGOs. So I want to do this through a case study of a project that ID Insight did with the Ministry of Health in Zambia, as well as the Clinton Health Access Initiative, and really ask this question of, can a randomized trial or a research or advocacy effort be considered a cost-effective charity that really leverages a lot of government funding? So the challenge was that the government of Zambia was trying to figure out how do we decrease maternal and infant mortality, which are very high rates, especially in rural Zambia. And they had a lot of ideas, but one of the key decisions they wanted to make was there were a lot of mothers that were delivering at home in unsafe conditions, and how do we incentivize them to actually travel to government health facilities, which presumably had better care, in order to deliver there. And so they're thinking about a number of different interventions, one of which was, can we do a behavioral nudge? So provide a small incentive for mothers to travel to the government facility and receive something called a mama kit, which is just a $4 kit of a bunch of things that a new mother might want for their kid to incentivize them to deliver in the facility rather than at home. But there are big questions around, would this be impactful? How cost effective would it be? And should we invest in it in the next fiscal year? And they faced constraints. There was no information or evidence on the effectiveness of things like mama kits, and there was very little budget for the evaluation. And so they had to make a decision by the next fiscal year about whether to scale up this program. And so we came in and said, okay, what's the theory of change? Mama kits get distributed at facilities, people spread the word about these mama kits, that might induce more mothers to deliver in facilities, and if mothers are delivering at proper healthcare facilities, then maybe that decreases maternal mortality. So this last link was well established in the public health literature. People knew that if you deliver in well-stocked facilities, you're likely to decrease infant and maternal mortality. However, it was quite uncertain whether just giving away this $4 mama kit actually incentivized anyone to come and deliver in the facility. And so that's what we decided. Given that the government needed to make a decision on short notice, we could design a rapid but rigorous randomized trial that just measured whether or not mothers came to deliver in the facilities. And so we designed this randomized trial in just 5 months and $70,000. So think about a rapid, inexpensive test that could potentially inform a very large-scale government decision that had implications for many mothers and children. And what we found after randomizing certain facilities to receive the treatment, certain facilities to remain as comparison groups, was that these simple $4 mama kits actually increased the percentage of women who delivered in a facility by 47%. And if you model that out, it roughly translates to around $5,000 per life saved. So the important thing to note here is that $5,000 per life saved is not as cost effective as most of GiveWell's top charities. And so if you think about this intervention purely from the lens traditionally of effective altruists trying to maximize which interventions get money, you would say that this doesn't really meet the bar. It's pretty good, but there are other sources and interventions that would be a better bang for the buck. However, if you think about it more from the point of view as, was that $70,000 investment in generating that evidence cost effective because it then compelled the government to scale up a program, I think it is a completely different question. We need to start thinking about those kinds of intermediated causes. And so there's clear benefits that such a small amount of money, whether it's for research or advocacy, has the potential to influence many multiples of government spending. However, from the point of view of an effective altruist that really wants to nail down, is my money demonstrably improving lives, there are clear challenges. The first is that attribution is very tenuous. So I can stand up here and say that it was ID Insight's randomized trial that led the government to scale up this program, but it's just as conceivable that the government would have scaled it up in the complete absence of evidence. And even if our evidence played a role in scaling it up, clearly there are other actors at play. The government is delivering the program, there are a lot of other people doing the work. And so how much of the lives saved can you actually attribute to this evidence? And I think this is one of the areas where effective altruists need to be comfortable or grow more comfortable with uncertainty. And so I think it's hard to pin down a clear cost effectiveness number the same way that you can with anti-malarial bed nets or deworming pills, but the potential leverage that you get from investing in these kinds of things could potentially be outsized versus direct service delivery. And then if you think about embedding these types of evidence teams within governments to diagnose what's wrong, come up with new ideas, evaluate them rigorously and scale them up, then there's another opportunity to unlock a lot more bang for your buck in terms of lives saved or lives improved, but you need to be comfortable with a higher degree of uncertainty about, is this money actually directly going to improving lives and what other factors are at play. Now the third claim, and potentially most controversial, is that effective altruists need to step outside of their own subjective values, moral weights, and preferences when determining how to do the most good, and instead weight more heavily the preferences, moral weights, and subjective values of populations living in rural Kenya, rural India, and elsewhere in the world, even if those aren't utilitarian worldviews. So I just want to start out by saying very clearly that effective altruists are at the forefront in using evidence and reason to determine how to do the most good. Organizations like GiveWell exemplify this by using randomized controlled trials, validating that with in-field measurement, and a wide range of folks, including the economists, say that one of the biggest intellectual achievements of the EA movement has been in the form of charity evaluation. However, for as evidence and reason driven as effective altruists are, there's a lot of subjective value that goes into resource allocation decisions. So even if you identify that AMF is a great cost-effective charity, you're still faced with the subjective trade-off of, should we give a household a direct cash transfer or save a child's life? That's not something that can necessarily be answered clearly using empirical evidence. If we have a set number of resources, should we save younger children versus older adults? And then further afield, if we have a set number of resources, how do we compare an animal's life versus a human's life now, or a human's life now versus a human that might exist in the future? And so all of these involve moral weights and subjective value judgments. And currently the approach is basically to rely on EA's own subjective value inputs. So here's a graph from GiveWell that basically shows different GiveWell staff member and how they would value saving the life of a child under 5 relative to doubling the consumption of one individual for 1 year. And so this is clearly a subjective judgment, and there's a wide range. So while the median is that people value doubling consumption of one individual for 1 year 50 times, you'd have to do that 50 times in order to save the life of a child, there's still a wide degree of variation and it's highly subjective. So this is a reasonable approach, and I don't want to kind of overly criticize it because it does make sense and we need to make these hard subjective trade-offs, but it's problematic for 2 reasons. The first is that EAs are weird, and weird in more ways than one, but what I mean in particular is that they're Western, educated, industrialized, rich, and democratic. And this means that EA preferences might be very different from the preferences and subjective values of beneficiary populations. The second is that resource allocation is quite sensitive to these subjective preferences. So we like to think that we've done all these randomized trials, we know what the cost effectiveness is, but when you're deciding between Give Directly and AMF, there's a lot of subjective input there. And so we might not be doing the most good possible if we are ignoring the differences in preferences and subjective values of EAs versus beneficiary populations. So first, EAs are weird. I want to establish this fact. So Joseph Henrich and his co-authors have done a number of experimental psych and behavioral science experiments that show that weird subjects are particularly unusual compared with the rest of the human species. On all psych experiments, including visual perception, fairness, cooperation, and perhaps most importantly for us, moral reasoning. And so people from these industrial societies consistently occupy the extreme end of the human distribution. So this is clearly potentially problematic when trying to determine how to do the most good with this fixed set of resources. And just one example of this is the ultimatum game. So in the ultimatum game, there are 2 players. One player is the proposer, who's given a sum of money by the experimental psychologist and then has to decide how much of that money to give to the receiver, the second player. Now, the second player basically can accept that proposal or reject it outright. If they accept it, then both people split the money, and if the receiver rejects it, then no one gets anything. And so this is kind of a classic behavioral science experiment to determine society's notions of fairness and economic equity. And what Henrich and al. Find is that the US is a clear outlier compared to a whole host of other societies. And so while Accra, the capital of Ghana, is quite similar, you might say that there's no difference between low-income and rich countries, but I think it's more a product that industrialized, capitalist, urban societies tend to have similar norms, whereas pastoralist or rural agrarian societies can have very different conceptions of moral reasoning as well as fairness. And this has significant implications for the types of trade-offs that EAs are faced with. Now, you could argue that it's fine that there are these different preferences, but in reality, cost effectiveness just comes down to the numbers and it's not that different. But when we look at the data, we find that cost-effectiveness models, such as those by GiveWell, are highly sensitive to these subjective inputs. So it's not just about the randomized trial and doing the math. A lot of it comes down to how do we trade off these different things. And so on the y-axis are a bunch of different GiveWell top charities. The yellow dots are how much better they are than cash. So how many times more cost-effective is this than Give directly? And so if you just looked at the yellow dots, you could say, okay, we have a very clear ordering of what's most cost-effective. But as soon as you incorporate the subjective values of how people trade off $1 today versus $1 tomorrow, health today versus increased consumption, you see that the picture becomes a lot messier. And another way of showing this is that Against Malaria Foundation is generally considered around 3 times as cost-effective as cash. But if you just move one standard deviation down in terms of people's subjective values of increase in consumption versus health, it looks like very strong. But if you go one standard deviation up, you're unlikely to recommend Against Malaria Foundation versus cash. And so I think this is another example that this is a very real non-academic trade-off that we're making based on our own subjective inputs. And so what can we do about this? So ID Insight and GiveWell are partnering to try to better measure beneficiary preferences and incorporate them into resource allocation decisions. So we did a pilot in rural eastern Kenya. We piloted 7 different methods of measuring preferences. I just want to highlight one, which is the giving framing. So we asked this question, which a lot of donors face. Imagine that someone in Kenya has a deadly disease. A donor has enough money to either save this individual's life or use that money to give $1,000 transfers to a bunch of households. How many households would need to receive this $1,000 transfer, anywhere between 1 and 10,000 households, for you to think that the donor should give the money away rather than saving the life? And what we find is that most respondents in rural eastern Kenya choose to save the life over giving cash transfers of any amount. So what we find here is that whether it's saving the life of a 1-year-old, 12-year-old, or 30-year-old, over 60% of respondents say that you should always use the medicine, even if it means spending $10 million on that. And you could have given 10,000 households a $1,000 household transfer. Now, this is very different from what EAs would do. On average, EAs kind of trade off 15 to 30 households getting a $1,000 cash transfer versus saving the life of a child. And so this points to, like, why are Kenyans, rural Kenyans, so different from what we find in high-income country experiments and GiveWell staff? So you could just say it's methodological challenges. People don't understand the value of $1,000. They might have social desirability bias, want to seem that they're magnanimous to someone who's dying. There are conceptual issues. Maybe they actually have different values of life than people in high-income communities. But respecting those preferences might mean valuing lives there less than valuing lives here. But then the reality could be that the average person in rural eastern Kenya has a deontological worldview, and EAs have utilitarian worldviews. So what do you do in that case? And I think there's no easy answer, but at the very least, we need to grapple with how do we incorporate those kinds of Kantian or deontological worldviews if we want to maximize the welfare of those people. And so you can imagine a scenario in which you weight the beneficiaries' preferences with the preferences of a utility maximizing EA in order to come up with some hybrid, or you make a hard call and say that since we're maximizing the welfare of people in rural Kenya, we're going to go with their worldview, even if it's highly deontological and opposed to the utilitarian worldview that you might hold as an EA. And I think that this approach to thinking hard about preferences of communities outside EA is very valuable and important for determining how to do the most good, and has implications not just for global development, but also in terms of how we make trade-offs between farm animal welfare in the far future now. And I think that this is all very nascent. A lot of these numbers are, I wouldn't quote them as final numbers. These are still pilots. But what it does highlight is that there's tremendous scope for us to change our priors on how to do the most good possible once we start incorporating the actual preferences, subjective values, and moral weights of different populations. And I think that this could have tremendous implications for the EA community as a whole, and that we need to invest more resources into researching and getting this answer right. Thank you.
All right, so we've got about 5 or so minutes for questions. A few are starting to come in. Again, you can always do that through the app or the website. Fascinating talk. I love the notion of just kind of challenging everyone to rethink some of their priors and kind of our own perspective on where the value is. I guess the first counterargument that might come back to you would be like, look, all those people that you cited from the Give Well or the Open Philanthropy, they've thought a lot about this, right? Whereas you're kind of asking someone in a village sort of setting probably hasn't had this kind of trade-off put to them before. How do you think about that difference in just kind of how much energy and maybe education is behind those answers?
Yeah, I mean, I think that's a great point and something that we're trying to think through. So Cindy Lee, who's the lead ID Insight economist leading the study in the front row, she's been brainstorming other ways to address that. So one idea is actually to do like a mini boot camp or course in moral reasoning for people living in rural eastern Kenya, to say like, okay, these are different ways you can think about these trade-offs and then playing the games. I do agree that on first blush, if someone hasn't thought a lot about these kinds of trade-offs, they might come to conclusions that otherwise they wouldn't. So I think there's a lot of work to be done in investigating how do we actually get the right answers and elicit the true preferences of populations rather than their first gut instinct.
Yeah. Questions are coming in fast and furious. We'll see how many we can roll right through. What advice would you give to an undergraduate seeking to pursue a career in development or the alleviation of global poverty?
Yeah, it's a great question. I mean, there's like the simple rubric, which I think is pretty prevalent among EAs, which is where is my marginal impact going to be highest? And so thinking about what am I uniquely willing or able to do? And hopefully the intersection of those. And I think there's no right answer to that. It intersects so much with your particular skill sets. But I think trying to find the underinvested in aspects and then plugging yourself in and doing the things people aren't willing to do. So one idea that comes to mind is that there are, in rural India, for instance, there are state governments that make decisions for 50, 100 million people that are often understaffed on technical expertise. And so that's one area to go to, a state that's not sexy, it's not Delhi, it's not Bombay, and really try to help bureaucrats make better decisions when they're understaffed.
Next question, kind of similar to the first one that I asked, but with a bit of a different twist, and maybe a bit provocative. Why, if someone is going out to attempt to do good in the world, one view would be that it's really only their own conception of the good that matters, and they don't really necessarily need to take into account anybody else's point of view, whether beneficiary or hypothetically someone in like a third location. You might say like, you're going to try to help people in Kenya, you could survey people there. You could also survey people in Norway, and arguably like neither of those are really relevant to what the actor is trying to accomplish. So what's the kind of baseline case that we should take other people's point of view seriously at all?
Yeah, I mean, I think a lot of this reduces down to just personal preferences, and it's hard to adjudicate what's the right way, oftentimes, at least from my perspective. I think what I would say is, if you're in the room, you're probably thinking about how do I maximize the welfare of the most people. And so if you're coming from that perspective, I would generally think of like the Rawlsian thought experiment of, if I had no idea where in the world I was going to be born, then what kind of system would I want to create? So if I knew as a man or female, gay or straight, born in rural Kenya or urban US, what's the system that would most maximize my chances of a good life? And then from that vantage point, basically try to make choices. And that's at least the way that I think about it. But ultimately, there's a degree of arbitrariness on whether you buy into that or not, and whether you try to maximize your own welfare as you exist today versus some other hypothetical welfare.
That's essentially a veil of ignorance argument.
Exactly.
So kind of downstream of that, where do you think policymakers today fall on that question? Do you think they buy into the veil of ignorance argument or not? And maybe you could segment that by different sets of policymakers.
Yeah, I don't think that they do, in large part. I think mostly policymakers that we work with are responding to clear sets of incentives around maintaining power. And so the extent to which they're utility maximizing for their populations, I think, depends a lot on the robustness of the civil society and the government, how truly democratic the society is, and it's kind of maximizing power within those constraints. And so I think there's just huge heterogeneity between different types of policymakers based on what the conditions are in that particular society.
Somebody asks, given the kind of emphasis on the recipient's preferences, how much does that lead you to think that just giving cash should be prioritized, because then people can obviously use that to realize their own preferences? The person asking the question says, doesn't it by definition mean that you should always give cash? I can think of a couple caveats, but how do you think about that?
Yeah, so that's definitely not the conclusion that I come to. I think that there are a lot of public goods that individual consumption decisions always underinvest in. So public health is a great example of that, like if you invest in spraying for mosquitoes, that's not something that an individual household can just use a cash transfer to do necessarily, because the more households in a village that do that, you might reach a threshold effect that actually dramatically decreases the risk of malaria for the entire village or the entire community. And so I think there are the big payoffs and gains in utility come from investing in public goods that no single individual could do, whether that's like decreasing pollution or investing in infectious disease prevention, are areas where those kinds of investments are much higher in terms of utility gain than just giving cash to an individual.
So there are definitely more questions here than we'll have time for. Are you going to be available for office hours today during the next break?
Hours. Yep.
Okay, cool. So that'll be at 4:30 across the way. Time for maybe one or two more questions. Would you and maybe would ID Insight find it valuable to try to do some of the research that you're doing on preferences within the context of developed countries? Somebody's suggesting potentially the New South Wales health system as kind of a model. I don't know anything about that particular health system, but are there kind of advanced models that you can go into and then try to port your learnings to other places?
Yeah, I just don't know enough about that model to really respond, unfortunately.
Fair enough. Then last one, what were the 6 other ways?
So the other thing I would say is like for issues like how do you trade off utility gains today for humans versus utility gains in the far future, I think that obviously normative moral reasoning has a lead role to play in social justice causes like abolitionism or women's suffrage. Like you can't just always rely and fall back on individual preferences. However, I think when you're on pretty philosophically shaky ground, it's very useful to at least collect preferences from a wide range of populations in order to better understand what the status quo is and better understand how to ground those philosophical arguments. And so I think there's a big role in collecting preferences on those types of issues across a wide range of societies today. Even if they're not determinative, at least they're informative to the kind of moral reasoning that leads those kinds of trade-offs.
I think that's probably a perfect place to end it. We are at a time. Find Dr. Neil Buddy Shah over at Office Hours. For now, a warm round of applause.